Assalamu alaikum warahmatullahi wabarakatuh. Today we will discuss oral ulcers and halitosis. Oral ulcer causes may be precipitated by different conditions like food. For example, eating chocolate and drinking coffee may increase the incidence of oral ulceration. Lack of essential vitamins like vitamin B12, zinc, folic acid and iron, allergy to some mouse bacteria, and dental braces, and hormonal changes, especially during menstruation, very common to occur with it. Oral ulceration, emotional stress and lack of sleep, as for example in the periods of exams and different emotional stresses. Also the presence of bacterial, viral and fungal infection. Another causes may be minor mouth injury from dental work or hard brushing or sports injury, and accidental bite during chewing, and tooth pastes and mouth rinses that contain sodium lauryl sulfate also can lead to oral ulceration. Sometimes in patients with sensitivity to some foods like acidic food, spicy foods, and citrus food, strawberries and pineapple, and other triggered foods like chocolate and coffee, as we said before. There is also systemic diseases that can cause oral ulceration like celiac disease, inflammatory bowel disease like Crohn's disease, diabetes mellitus, Behçet disease, which is an autoimmune disease which is characterized by ulcerations, oral ulceration and genital ulceration, and venous affection. Autoimmune diseases like systemic lupus erythematosus and rheumatoid arthritis, also the patient may have oral ulceration, and some infections like HIV infection due to increased fungal infection. Halitosis means bad odor of the mouth. Bad odor of the mouth is a very common problem that can affect one from each 4 persons worldwide. Again, anyone can suffer from bad breath. It is estimated that 1 in 4 people worldwide have bad breathing or halitosis. Halitosis is the third most common reason that people seek dental care after tooth decay and gum problems. The causes of halitosis are variable. It includes something in the daily behavior of the patient and others due to systemic causes. Daily behavior like tobacco can cause halitosis by: number 1, each type can cause their own odor in the mouth, and sometimes by increasing the chances of gum disease, which leads to bad odor of the mouth. Food, certain food or the breakdown of the food particles stuck to the teeth and can increase the bacterial overgrowth and can lead to bad odor. Some food have a special odor like onion and garlic, and digestion of it or increased intake of it leads to bad breath, whether by the presence of it in the mouth and the stuck parts of it in the teeth. Also, but after digestion of these substances, the breakdown products of it are excreted via the lungs and also affect the breath. The presence of dry mouth. Saliva helps washing the mouth and avoid accumulation of bad odor, and so in dry mouth, whether the patient has dry mouth due to decreased saliva secretion or as a result of a disease like xerostomia, which is present in some diseases like Sjogren syndrome, and the patient usually complain from bad odor. Lack of dental hygiene. Brushing removes small particles of food and which are stuck to the teeth, which are responsible for producing the odor. Also, a film of bacteria, which is called plaque, is formed over the teeth and causing irritation of the gum and causing inflammation, which leads to bad odor. Okay, so brushing removes this bacteria and remove the food stuck to the teeth, and so it prevents the occurrence of bad odor. Denture. The presence of dentures may harbor the bacteria and may lead to stacking of the food particles, and this can lead to bad odor of the mouth, especially if the patient does not do oral hygiene or proper hygiene of this dentures. Crash diets. Eating fast diet and low carbohydrate diet leads to bad odor of the mouth as a result of metabolism and degradation of the fat into ketone bodies, which increases its excretion in the mouth and leads to bad odor of the mouth. Drugs. Also, some drugs can cause bad odor of the mouth, like drugs which decreases the saliva, drugs which leads to breakdown and release of certain chemicals in the breath, like nitrates, like some chemotherapy. I'm so sorry, like tranquilizers as phenothiazines. Also, some vitamin supplementation when the patient take it in a large amount leads to bad odor of the mouth. Another causes of bad odor of the mouth or halitosis are mouth, nose, and throat infections like tonsillitis, like sinusitis, like post-nasal discharge. All of it leads to bad odor of the mouth. The presence of foreign body, especially in the children, which is stuck or lodged in the nasal cavity. This is very common in the children to produce a very offensive odor of the mouth. The presence of certain diseases like cancer of the oral cancers or cancer of the nose or cancer of throat, liver cell failure, gastroesophageal reflux disease, all of these can cause bad odor of the mouth. Another causes include ketoacidosis, which is a condition that can occur in the diabetic patient as a result of lack of insulin with dependence on free fatty acids as a source of energy, with metabolism or breakdown of free fatty acid and formation of ketone bodies, which are excreted via the breath, causing bad odor of the mouth. Bowel obstruction, especially in the case of pyloric obstruction or gastric outlet obstruction. This means it's obstruction of the outlet of the stomach, preventing the food from moving away from the stomach. So it is accumulated in the stomach, causing dilatation of the stomach, and it may be regurgitated or may be vomited and giving a very bad odor to the mouth. The presence of pouches, for example, pharyngeal pouch, for example, with retained food in it, also can cause halitosis. Bronchiectasis is a disease affecting the bases of the lung. There is dilatation of the bronchi with infection and the presence of sputum, which is usually in the form of pus. And so the patient have expectoration with pus and very bad odor of the mouth. Aspiration pneumonia also can cause bad odor of the mouth, and this is commonly occur in old patients with regurgitation and with bad oral hygiene. How to diagnose the halitosis and how to detect the etiology of it? The dentist will simply smell the breath and try to detect the cause and the source of this halitosis. Also, he can scrape the back of the tongue and smell the scrapings, which may be the main cause of the presence of bad odor of the. There is some tests which are used for diagnosis of the bad odor of the mouth or the cause of bad odor of the mouth. We have what's called the banana test, which measures the levels of specific enzymes produced by halitosis causing bacteria. We also measure beta-galactosidase test level, which can measure the level of the enzyme beta-galactosidase, which is found correlated with bad odor of halimeter. Halimeter is a measure for measuring the level of the sulfur. Gas chromatography, which measures 3 volatile sulfur compounds including hydrogen sulfide, methyl mercaptan, and dimethyl sulfide. How to manage? First of all, good hygiene. This is a very important method. Brush your teeth at least twice daily, but better after each meal. It is very important. Number 2, flossing reduces the build-up of food particles and plaques from between the teeth. Brushing only clean around 60% of the stuck food, and floss is very important. Clean dentures. Dentures, bridge, or mouth guard should be cleaned as recommended on daily basis. And also changing brush every 2 to 3 months is very important for similar reasons. Brush the tongue. Bacteria, food, and the dead cells commonly build up on the tongue, especially in smokers or those with particularly dry mouth. A tongue scraper can sometimes be used. Avoid dry mouth. Drink plenty of fluids. Avoid alcohol. Avoid tobacco, which are both can cause dry mouth. Chewing gums and sucking a sweet, preferable sugar-free gum can help stimulation of the production of the saliva. I'm so sorry. Diet. Avoid onions, garlic, and spicy foods, and fatty foods, and sugary foods which contain high content of fat and high content of sugar, and reduced coffee and alcohol. Also, eating a breakfast that includes rough foods which can help cleaning the back of the tongue are mandatory in management of halitosis. This is my last slide, and thank you for all of you. We are happy to receive any questions from you.